So my name is Dr. Sam Bunzli. I'm originally a physiotherapist and I'm now a Conjoint Senior Research Fellow at Griffith University and the Royal Brisbane and Women's Hospital in the physio department there. I'm a qualitative researcher, so I spend most of my time gathering stories, so listening to people with lived experience of pain, their carers and their clinicians that are caring for them as well. All high quality clinical practice guidelines recommend person-centred care as being the cornerstone of high value care, but we see a big evidence practice gap. So while these are recommended, we often hear, or we still hear stories of people that are feeling invalidated, dismissed, or even stigmatized at times by the professionals that they're seeing, including physiotherapists. So we still see, we have a problem there, that people are in pain, they're seeking help, but they're not feeling heard by their physios. So person-centered care is important, but what is less well described in the clinical practice guidelines or in the literature more broadly is actually what that looks like in practice. So our session at the conference here was looking at exactly that. We were trying to have a better understanding of what person-centered care looks like in practice, and we invited along 4 experts in this area to share with us their approaches to person-centered care. So when we are working with somebody in pain, they're coming to see us, they are distressed, they're in a difficult place and they're looking for our help. So it's really important that we have the time to sit with them, to understand their experiences, to provide some validation for what they're going through, and then support them on the pathway to recovery. And that's a partnership that involves a collaboration between the clinician and the patient that is coming in and seeing us for their help. Listening to people's story in the first instance is really important. We want to know what is important to them. What are they coming and needing our help for? So spending the time in the first instance to just ask the open question of how can I help you? What are you here for today? In our session, Tamar gave an excellent example of the busy clinician within a UK NHS setting where there might only be 6 minutes in that session, and the person comes in and sits down and the clinician says, look, we've got 6 minutes today. What do you need from this session? How can I help you in the 6 minutes that we have today? So it's important that we are understanding what is the goal of the person that is coming and seeking care, seeking our help, and understanding that sometimes we don't have a lot of time to be able to do that, but it's still really important that the way we are communicating is in such a way that we are able to support the person to get the most out of that session that they can. So the reason that we hosted a session on person-centered care is because too many people continue to report feeling dismissed and validated or stigmatized by their care professionals. So the Chronic Pain Australia report and the National Pain Survey last year was showing that around 7 out of 10 people with chronic pain are reporting feeling dismissed by their care professionals, and this is higher in younger people and in women, whereas as high as 9 out of 10 people with chronic pain are experiencing these sort of sense of being dismissed or invalidated by the professionals they're seeing. So yes, while we might think that's important, we might think we're doing this in practice, when we actually hear from the patient's perspective, the patient side of things, this isn't happening as widely as it needs to be happening. Physios are well placed to dig a bit deeper with their patients because we are often a central member of their care team. So we do tend to have a little bit more time with the patients than what our GPs might have, our GP colleagues. And if they are being referred into specialist care, often specialists are have very limited time with the individual as well. So we are well placed to have time to build that relationship with our patients, to really understand what their priorities, what their goals, what their values are, and support them on that pathway to recovery, working in collaboration with them.